First, let's go to Ethiopia, where the government troops have been regaining territory that was lost to Tigrayan forces based in the country's north. It is the latest chapter in a conflict that has caused enormous suffering in the Horn of Africa. The country has been fighting a civil war for more than a year now. Forces from the Tigray region have been battling government troops in a conflict that has drawn in neighboring Eritrea as well. Both sides are accused of committing atrocities and have taken and retaken territory with no ceasefire in sight. Meanwhile, tens of thousands of civilians have died and millions have lost their homes. Correspondent Maria Gert Niculescu traveled to the Amhara region to meet some of the people who have been affected.
This is all that is left of Ayub Erhan's house. It was demolished by artillery fire when the Ethiopian army and Tigrayan forces clashed in the area.
This is where the table was. It's all broken now. Look at it. It was a nice house. It was beautiful.
She hid in a forest for 9 days while Tigrayan rebels occupied her village on their way to the capital.
We feared for our lives. We didn't know if they were going to kill us. We had children with us. We were scared. I was with my neighbors. At night it was very cold.
The conflict has not spared civilians. In this village, residents say 21 people were killed by Oromo and Tigrayan rebels.
In this mass grave, we buried 4 people per hole. They weren't soldiers. They were unarmed civilians. Local people buried them. We collected the bodies after they left, and there were some bodies which the hyenas had started to eat.
Hundreds of thousands of people have fled the violence. Mamito Belachu and her children sought refuge in this makeshift camp in Debre Berhan. But she says it lacks everything.
There's nothing to eat. We have children and there are no clothes. People left their homes without their belongings. We're being told it's safe to go back, but what do we have to go back to? They burned down our houses.
It's not just people's homes. Public infrastructure has also been destroyed. This hospital in Dessie was heavily looted.
We had antibiotics here, and now we have nothing. Around here we had medicine to treat hypertension, mental health issues.
The hospital was a referral center for 8 million people.
All this waste material you see here, they just threw it there. This is trash, but among it there are also medicines which we could have used.
People in Amhara already had difficulty accessing food. The war has made that worse. The UN says armed men and local communities looted aid warehouses such as this one. And the government accuses Tigrayan forces of disrupting the harvest.
They came when the crops were matured and ready to be harvested, so they destroyed them. Not only the crops that had been harvested, but also those that hadn't been collected yet.
The conflict has affected everything. These people in Amhara are the ones we can see. In the neighboring Tigray region, a grave humanitarian crisis is also unfolding, but no one is allowed to go there and report on it.
So for more, let's talk now with Patrick Youssef. He is the Regional Director of the International Committee of the Red Cross in Africa. Thank you so much for taking the time to come on to DW News. What are the most pressing needs in Ethiopia right now, and which areas are you primarily addressing in your work with the Red Cross?
Great, good morning, and thanks for having me. Indeed, this crisis has affected not only people in the north, but all Ethiopians as a whole, where needs are rising very rapidly. Conflict lines are very much still evolving. And the needs of the most acute needs are seen in the displaced civilians community, which needs are acute, notably in Amhara and the Tigray regions. Indeed, children are separated sometimes from their families, the precarious conditions, they're exposed to many forms of violations. And indeed, we're also very much concerned over the food situation in the north of Ethiopia primarily, but also in other parts where indeed, as your report has mentioned, healthcare in and around conflict areas remain under enormous strain.
So children separated from their families, shortages of food. We've seen how much death and displacement has come from more than a year of war. And yet, as you say, the conflict is spreading. So how exactly has the fighting affected your efforts to help people on the ground?
You know, as I said, conflict lines are still evolving very rapidly, even when we count only 14 months onto the crisis in the north and other parts of Ethiopia. We try and manage somehow to adapt our operational aid response to the most urgent humanitarian needs. But indeed, as I said, the delivery of humanitarian assistance continues to be hampered by fighting, by insecurity, but also by constraints imposed on organizations, local or international, to get access to the most needy civilians. And here we need to call on all those who are fighting to allow such a delivery of assistance, because they're not only vital, but they're urgently needed to save lives, and not only to help people cope with the ongoing fighting. So it's imperative today that we move in that direction.
And is your access currently being prevented by both sides in the fighting?
Well, we are where we need to be when it comes to having physical presence in Mekelle, in Shire, in the Oromo regions, in the south and the east. But indeed, what needs to be done is a full scale-up, and a very urgent scale-up. In other circumstances, we would have been able to reach every person who requires assistance, and there are no absence of organizations to do so. But indeed, what we need is to be next to those who should not be disappointed today by the humanitarian community, by those fighting, to get what they need most, is to get the food, the water. It's not a luxury to ask for healthcare in such situations, and that's what we're really calling for, and that's what we're trying to increase by the minute in negotiating, in having full and transparent dialogue with all those weapon bearers who have a direct impact on people's lives today in Ethiopia.
Patrick Youssef of the International Committee of the Red Cross, thanks so much for taking the time today.
Thank you.